Thank you, Governor Dayton, for your kind introduction. It is an honor to stand before all of you today. I would like to extend my deepest gratitude to NGA for inviting me to share today, and for the proactive work they continue to do around the issues of the opioid crisis and addiction. And thank you to everyone in this room, governors, fellow first spouses, and the hardworking staff and team members who get up every day ready to transform the lives of citizens across our country. There are two things I never thought I would ever do. One is be First Lady of anything, and two, have the opportunity to share my story to a room full of the most impassioned leaders committed to leadership and change in our communities. But by some crazy set of circumstances, or maybe by divine intervention, I am both First Lady and am standing in front of you, full of gratitude for the opportunity to be here today. The chronic disease of addiction, including the opioid crisis, are some of the biggest challenges facing our nation. I don't pretend to be an expert on the disease of addiction, but I do have lived experience. I've been in recovery from alcohol addiction for over 16 years. Thank you. I spent 15 of those years in silence, keeping my recovery in the closet like a shameful secret. Sadly, only 1 in 10 people who need treatment for addiction actually seek treatment. And I know that because I was one of those statistics. I knew for years that I needed help, but I didn't seek it because I was ashamed. For people with the disease of addiction, 3 words have deprived them of medical treatment: empathy and compassion, for decades, or more like centuries. And those 3 words are shame, stigma, and discrimination. My journey with addiction started when I was in high school in North Dakota when I first started drinking. I knew as a teenager I didn't drink like others. I had my first blackout when I was in high school. I struggled with alcohol-related issues and episodes over the next 20 years. I chose to live and work in cultures with excessive drinking. I had no desire to attend events without alcohol, and I couldn't imagine my life without alcohol. While constantly struggling with my addiction, my career progressed, and I had forward movement in my life, but I could never reach my full potential with my addiction holding me back. There came a time when I knew I needed to stop drinking, but addiction's a powerful disease, and it kept me drinking for many years. I could achieve any goal I set for myself, but I could not stop drinking, even though I experienced many baffling, demoralizing, and defeating drunk episodes. I'd stop drinking for 3 months, and then I'd start again. I'd stop for a year, and then I'd start drinking again. And this cycle continued over a period of 8 years. I'm so grateful that my higher power kept asking me to pull on my boots and try again. I finally became willing to do whatever it would take to stay sober. And when I became completely willing, that's when the miracle happened for me. And I started staying sober. I found a program that's built on a foundation of gratitude, of helping others, and a higher power. I found a program that's built on a foundation of gratitude, of helping others, and a higher power, and it has saved my life. I will forever be grateful to the program and its people for embracing me and helping me find recovery. My openness about my recovery has started what I hope will be a lifetime of advocacy, speaking out for those who've been misrepresented and misunderstood, and creating opportunities for people, families, and communities devastated by this disease. As First Lady, it's my ultimate mission to end the stigma and shame of the chronic disease of addiction. Stigma, which is defined as the mark of disgrace, is a persistent barrier to effectively confronting addiction and finding recovery. With addiction, stigma puts up walls instead of building bridges. It is socially constructed, based in fear, and usually accompanied by a lack of inaccurate information. I met the parents of a teenage boy who died of an opioid overdose in his car in a high school parking lot. They were devastated by their son's needless death. However, there was no outpouring of community support, like there would be for a teenager who died of cancer or of a car accident. Shame and stigma keep people away. I believe addiction needs to be embraced like any other chronic, progressively fatal illness or disease before real changes can be made in our communities and before the shame and stigma can be eliminated. Addiction is not a choice. It's not a character flaw, and it does not discriminate. The stigma of addiction started way back in the 1930s when scientists began studying addictive behavior because people addicted to drugs and alcohol were thought to be morally flawed. And those views shaped society's responses to addiction, treating it as a moral failing rather than a health problem, which led to an emphasis on punishment rather than prevention and treatment. Alcohol addiction was declared a disease by the American Medical Association way back in 1954. Welcome to 2018, where addiction is still viewed by many as a lack of willpower and a character flaw, and is amazingly still approached with punishment rather than treatment in many communities. The punishment approach brings with it a powerful shame and stigma that influences our laws, our services, research, healthcare, and support for people with the disease of addiction. Now more than ever, we must be driven by data and facts and recognize the science behind the chronic brain disease of addiction. Scientists, physicians, and even the Surgeon General agree that addiction is a disease. When people have the chronic brain disease of addiction, their brain gets hijacked in a biological way, manipulating dopamine levels to tell the person the highest priority in their life is the disease of addiction, and the only choices are drugs and alcohol. It's hard for people to accept the concept that addiction is a disease. I know how hard it is because I didn't believe it myself. I thought I could make the right choices. I thought I could do the right thing. But after relapsing for 8 years and literally thinking that I must be insane, I now understand that no one would choose to live that life. No one chooses drug overdoses or to lose everything in their lives because of meth or to die from years of addiction to alcohol. With compassion, we need true understanding. And sometimes that understanding comes from having the humility and courage to unlearn the things that we've held as truths for our entire lives. A universal acceptance of addiction as a disease across our nation will save lives and provide futures for our next generation of leaders and innovators. It may come as a surprise to you, but there's actually a simple solution to eliminating the stigma of addiction. A solution where everyone across the nation can participate. The simple solution is talk. Those in recovery sharing their stories, caregivers talking about those that they help struggling with addiction, those in public service talking about addiction and recovery, and corporations creating safe environments for people to talk about addiction and recovery at work. Talk will eliminate the elephant in the room and normalize the conversation around addiction. If we do this, the stigma will be eliminated. More people will seek treatment and find recovery. And everyone who's talking about addiction will be saving lives. This is a grassroots movement that costs nothing, doesn't need any legislation, and could easily be the one thing that crosses all political party lines to unify and truly make a difference for our nation. The opioid crisis has brought addiction to the forefront. While the focus revolves around opioids, addiction is a constant no matter the substance. This evolving crisis needs to be met with a holistic, adaptive response, especially in our healthcare systems, that focuses on the disease of addiction, rather than creating systems and processes for one specific drug, opioids. Treatment can work, and recovery is possible. And there continues to be innovation in treatment and recovery. One of the leaders in the field of addiction is the Hazel and Betty Ford Foundation. They've created an innovative program called Core 12, which combines multiple approaches, including medication-assisted treatment, therapy, 12-step programs, and peer support. In North Dakota, we're focusing on several innovative initiatives. We're working hard to eliminate the shame and stigma of addiction in our state. We will be using evidence-based methods to create a system to measure our progress on eliminating stigma. In collaboration with our behavioral health team and the Addiction Policy Forum, we are conducting a survey to establish a baseline measurement for stigma that we can measure against in the future. Data will show if we're moving the needle. Data helps drive funding. Data can change minds and create systems to ultimately save lives. 80% of those incarcerated in our state have an addiction. They need treatment and not incarceration. During the last 30 years, it was thought that more punishment would mean less addiction. Those with the disease of addiction who are convicted of nonviolent, possession-related crimes carry the extra burden and stigma of being a felon when they are released from prison. And they often receive no treatment for their disease while incarcerated. After doing their time and paying for their crimes, felons can't find jobs, and they can't find places to live. The felony discrimination towards the disease of addiction perpetuates the cycle of addiction. Through an innovative program called Free Through Recovery, we are giving those dealing with substance abuse who become entangled in the legal system the opportunity to recover successfully in their communities with care coordinators, with support from care coordinators and peer support specialists. And reimbursement for the Free Through Recovery program is outcome-based, with opportunities for incentive funding for meeting performance benchmarks. This reimbursement model is innovative and unprecedented, and this model pays for wellness and recovery. And the program is working. Goals are being achieved, incentives are being paid, and active revocation and absconder rates are decreasing in our state. As we build recovery support for the citizens of our state, this is a model that we would like to roll out to all of our citizens, not just those in the criminal justice system. So to close, I'm so grateful and honored to NGA for inviting me to be with you today. I encourage all of you participating in policy development around the disease of addiction at both the federal and state levels to include people in recovery, to help shape the policy that can truly make a difference. Bring those with lived experience to the table to show what recovery looks like and help provide the hope for the future. Now is the time to put aside stereotypes and put aside intolerance. Now is the time to come together to help those suffering from the disease of addiction. Now is the time for every one of us to take action in our own lives, in our work, and in our communities. There's no shame in addiction, and there's so much hope and possibility in recovery. I am like more than 23 million other people across our great nation who has the disease of addiction. And I am a face and voice of recovery. Thank you.